Today we're gonna discuss pharmaceutical suspensions. Under following head we'll discuss pharmaceutical suspensions, their definition, how they are classified, their advantages and disadvantages, and their respective applications. Definition: the pharmaceutical suspension is a coarse dispersion in which internal phase, that is therapeutically active ingredient, is dispersed uniformly throughout the external phase. The internal phase consisting of insoluble solid particles having a range of size 0.5 to 5 microns, which is maintained uniformly throughout the suspending vehicle with the aid of single or combination of suspending agents. The external phase, that is a suspending medium, is generally aqueous. In some instances, we may use organic or oily liquids for non-oral use. The reason of formulation of pharmaceutical suspensions: when the drug is insoluble in delivery vehicles, to mask the bitter taste of certain drugs, to increase drug stability, to achieve controlled sustained drug release. Some examples of pharmaceutical suspensions present in the market: antacid oral suspensions, antibacterial oral suspensions, dry powders for oral suspensions generally present for antibiotics, analgesic oral suspensions, antihelminthic oral suspensions, anticonvulsant oral suspensions, and antifungal oral suspensions. Classification: based on general classes, oral suspensions. Example is pharmaceutical suspensions, antacid suspensions, tetracycline suspensions. Externally applied suspensions. Example is calamine lotion. Parenteral suspensions, procaine, penicillin G, insulin, zinc suspension. Based on proportion of solid particles, dilute suspensions contains 2 to 10% weight by volume of solid. Example is cortisone acetate, prednisolone acetate. Concentrated suspensions contains more than 50% weight by volume solid. Example is zinc oxide suspension. Based on their electrokinetic nature of solid particles, flocculated suspensions, deflocculated suspensions. Based on size of solid particles, colloidal suspensions. Suspensions having particle size of suspended solid less than about 1 micron in size are called as colloidal suspensions. Coarse suspensions. Suspensions having particle size of greater than about 1 micron in diameter is called as coarse suspensions. Nanosuspensions. Suspensions are the biphasic colloidal dispersions of a nano-sized drug particles stabilized by surfactants. Size of the drug particles is less than 1 micrometers. Advantages: suspensions can improve chemical stability of certain drugs. Example is procaine, penicillin G. Drug in suspension exhibit higher rate of bioavailability than other doses from that can be seen from here compared with solution, suspension, capsules, compressed tablets, and coarse coated tablets. Duration of onset of action can be controlled by suspensions, that is protamine zinc insulin suspension. Suspension can mask unpleasant bitter taste of drug. Example is chloramphenicol. Disadvantage: physical stability, sedimentation and compactation can cause problem. It is bulky. Sufficient care must be taken during handling and transportation. It is difficult to formulate. Uniform and accurate dosage cannot be achieved unless suspensions are packed in unit dosage form. Application: suspension is usually applicable for drug which is insoluble or poorly soluble. Example is prednisolone suspension to prevent degradation of drug or to improve stability of drug. Example is oxytetracycline suspension to mask the taste of bitter or unpleasant drug. Example is chloramphenicol palmitate suspension. Suspension of a drug can be formulated for topical application. Example is calamine lotion. Suspension can be formulated for parenteral application in order to control the rate of drug absorption. Example is penicillin, procaine G. Vaccine as the immunizing agents are often formulated as suspension. Example is cholera vaccine. X-ray contrast agent can be formulated as suspension. Example is barium sulfate for examination of alimentary tract. Featured desired in a pharmaceutical suspension. The suspended particles should not settle rapidly, and sediment produced must be easily resuspended by the use of moderate amount of shaking. It should be easy to pour yet not watery, and no grittiness is there. It should have pleasing odor, color and palatability. Good syringeability is desired. It should be physically, chemically and microbiologically stable. Parenteral ophthalmic suspension should be sterilizable. Thank you.